In the name of Allah, who is the most beneficent and the most merciful. Assalamu alaikum. First of all, let me introduce myself. I am Rumai Sarfan and I am the student of biochemistry. Today, the topic of my presentation is teeth in the field of chemistry and medical sciences. Now, let's discuss about teeth. Teeth are small, calcified, hard, white structure found in the mouth for mechanically breaking down items of food by cutting and crushing them. They are among the most distinctive features of mammal. It is the hardest living biological structure. Now let's have a look of its structure. It has basically three main parts. The first one is crown, the second one is neck, and the last one is root. Crown. It is the part of the teeth above gum. The outermost covering of crown is enamel. Enamel is the hardest material in the body. Neck. It is the part of the teeth between crown and root. Inside the neck, a cavity is seen and it is the pulp cavity. Blood vessel and nerve fibers are seen inside the pulp cavity. The tissues of the teeth get nourishment to these blood vessels. Root. It is the part of the teeth seen inside the gum. The material that fixes teeth to the socket of jawbone is cement. Now let's have a look of its function. Teeth are designed to perform specific functions. The first one is incisor, second one is canine, third one is premolar, and the last one is molar. Incisor. Incisor are narrow-edged tooth. It is located in the front and center of mouth. Incisors are sharp and blade-like for cutting food. For example, you might use them to bite an apple. Canine. Canine are the sharpest teeth with one cusp and one or two slightly flattened conical root. It is located between incisor and premolar. Canine are strong and pointed for tearing food. For example, you might use them to tear off a piece of tough meat. Premolar. Premolar teeth have features of both canine and molars. It is located beside the canines. It is used for crushing and tearing food. For example, you might use them for tearing and grinding food. Molar. Molar teeth are broad and flat on top. It is located adjacent to premolar. It is used for crushing and grinding food. For example, you might use them to grind up nut meats. Now let's discuss about the biology of teeth. Development of teeth. Teeth development is a complex process by which teeth form from embryonic cells, grow and erupt into the oral cavity. Following are the stages of development of teeth. The first stage is bud stage, second stage is cap stage, third one is valve stage, the fourth stage is crown and root formation, and the last is eruption stage. Bud stage. This first stage happens at the 8th week of intrauterine life. At this time, cells known as dental epithelium bud from a thick band of cells called the dental lamina, which forms inside the upper and lower jaws. These cells will eventually evolve to form a tooth germ, which is made up of all the soft tissue necessary to grow a tooth. Cap stage. During this stage, cells begin to shape the outside layer of the tooth, forming a cap that sits on the rest of the tooth bud. This cap is called enamel organ because it will later form a cells that produce enamel. The rest of tooth bud, known as dental papilla, will make the two interior layers of tooth. The first one is the dentin and the second one is the pulp. Bell stage. At this point, the enamel organ grows into a bell shape and two events take place. First, cells of the enamel organ differentiate, meaning they change functions. Depending on their new function, they will fall into one of four cells group. First one is inner enamel epithelium, second one is outer enamel epithelium, third one is stratum intermedium, and the last is satellite reticulum. Together, these cell groups work to develop the enamel layer of tooth. During the second event in this stage, the enamel epithelium folds into the future shape of the tooth crown and the dental lamina starts to break down. Crown and root formation. The outer two layers of your teeth, enamel and dentin, form during the crown stage. Ameloblast cells are responsible for creating enamel, while odontoblast cells create dentin. These cells come from the dental epithelium and the dental papilla. The tooth root, made up of root dentin and root canals, form a combination of three structures: the dental papilla, the dental follicle, and another important group of cells known as Hugwitz epithelium root sheet. Eruption stage. Once the crown of the tooth has formed and root has begun to develop, the tooth moves vertically toward the oral cavity so it can erupt into the correct position. Some of the jawbone above the tooth will resorb and other connective tissue will break down to help the tooth move. Depending on the type and position of the tooth, each will erupt at different ages. The primary teeth will erupt first, starting around 6 months of age, according to the American Dental Association. The permanent teeth will develop in the same manner as the primary teeth, beginning at 20 weeks in utero and continuing 10 months after birth. The third molar or wisdom teeth are not completely formed until an individual is approximately 5 years old, explained the reference module in Biomedical Science article. Now, next we discuss the teeth which surrounds the tissue which surrounds the teeth. The periodontium. Periodontium is a functional system of tissues that surrounds and support the tooth and attaches them to the jawbone. It consists of four main components. The first one is cementum, the second one is periodontal ligament, the third one is alveolar process, and the last one is gingivia. Cementum. Cementum is considered a support structure containing fibers extended to the periodontal ligament. Periodontal ligament are fibers that support and suspend the tooth in the alveolus or socket. Alveolar process. Alveolar process supports and stabilizes the root comprised of two layers of bone tissue. The inner lightweight porous is a cancellous or tubercular bones. The compact or cortical bone is a more dense layer structure to endure stress. Gingivia. Gingivia is mucosa covered epithelial tissue visible in the oral cavity divided into two sections. Free gingivia. Free gingivia surrounds the cervix of the tooth like a collar and fills the interproximal space. Attached gingivia are paler pink and can be observed on the internal surfaces, merges with free gingivia at a free gingival junction. Now let's discuss about the chemical composition of teeth. Dental tissue are made up of organic matter, minerals and water. Different percentage of constituent depending on calculation of proportion by weight or volume. The first one is enamel, the second one is dentin, and the third one is hydroxyapatite. Enamel. The enamel is composed mainly of hydroxyapatite, an organic substance highly mineralized and aligned in rods to provide maximum protection to the underlying dentin. Enamel contain very little organic matter, approximately 1.3% of dry weight or approximately 1.1% of wet tissue, but approximately 3% of the actual volume, 90% is inorganic. Dentin. Dentin is produced by a specialized cell called odontoblast that align matrix inside closely packed tubule. Those structure will even undergo mineralization, giving structural resistance. Dentin contain more organic matter, approximately 21% of dry weight or approximately 21% of wet tissue, but approximately 28% of the actual volume, while the inorganic part is approximately 72% of wet weight or approximately 48% of the actual volume. Hydroxyapatite. Hydroxyapatite is a natural mineral form of calcium apatite. The chemical formula is CF5PO4 3OH, but it is usually written Ca10PO4 6OH2. It is comprised primarily of calcium and phosphate. Tooth decay. Tooth decay begins when bacteria in your mouth make acid that attack the tooth surface. The load of carbohydrate, the sugar or starch in a diet cause damage to the tissue of a tooth. This can lead to a small hole in a tooth called a cavity. If tooth decay is not treated, it can cause pain, infection, and even tooth loss. Role of bacteria in tooth decay. Bacteria in your mouth feed on sugary, starchy food and drinks, for example, fruit, candy, bread, cereal, sodas, and juices. The bacteria convert these carbohydrates into acid. Bacteria, acid, food, and saliva mix to form dental plaque. This sticky substance coats your teeth. Without proper brushing and flossing, acids in plaque dissolve tooth enamel, creating cavities or holes in the enamel surface. Use of fluoride to prevent tooth decay. Fluoride exerts its anti-carcinogenic action when administered topically through three mechanisms. It inhibits tooth demineralization, it promotes tooth remineralization, it inhibits plaque bacteria. Fluoride in drinking water and fluoride-containing products like toothpaste, mouthwash, and varnish work through these mechanisms. Fluoride prevents tooth decay by making the enamel more resistant to the action of acid. They accelerate the buildup of healthy minerals in the enamel, further slowing the occurrence of decay. Studies even show that in some cases, fluoride can stop already started teeth decay. Now, let's discuss about teeth in medicines. Dental stem cells, which is also called dental pulp stem cells, are stem cells present in the dental pulp, which is the soft tissue within teeth. Dental pulp stem cells were the first type of dental stem cells to be isolated, which were obtained by enzymatic digestion of the pulp tissue. These are fibroblasts-like in morphology, clonogenic in nature, and can maintain their high proliferation rate even after extensive subculturing. Dental stem cells can also be extracted from the apical papilla of shed primary teeth. Clinical studies of dental pulp stem cells also characterize their role in bone augmentation in tooth extraction sockets. Sources of dental pulp stem cells. 5 different dental stem cells have been isolated and characterized. First one is human adult dental pulp stem cells. Second one is stem cells from human exfoliated deciduous teeth. Third one is periodontal ligament stem cells. Fourth one is stem cells of apical papilla, and the last one is dental follicle precursor cells. Use in drug testing. Understanding stem cells' behavior as a delivery tool in cancer therapy is essential for evaluating their future clinical potential. Previous in vivo studies proved the use of mesenchymal stem cells for local delivery of a commonest anti-cancer drug, paclitaxel. Dental pulp is a relatively abundant, non-invasive source of mesenchymal cells. We access dental pulp stem cells for the first time as anti-cancer drug carriers. Confocal Raman microscopy is a unique tool to trace drug and cell viability without labeling. Use in research. Stem cells are one of the most favorable areas of biology. Stem cell plasticity has resulted in a new field of medicine entitled regenerative medicine and dentistry. Scientists have successfully regenerated tooth root and supporting periodontal ligament to restore tooth function in an animal model. The breakthrough in stem cell research holds significant promise for clinical application in human patients. Teeth in forensics. Forensics odontology involves the management, examination, evaluation, and presentation of dental evidence in criminal or civil proceeding, all in the interest of justice. The main aspects of forensics odontology include dental identification, age estimation, sex determination, role in mass disaster, role in domestic violence, abuse, neglect, identification of bite marks, blood group determination, recent advances, DNA typing, computer-assisted dental identification, digital analysis of bite mark, and digital autopsy. This is done using ante-mortem dental records, radiographs, and photographs, and by comparing them to post-mortem records. Dental radiography. Dental radiographs, commonly known as X-ray or radiograph, used to diagnose hidden dental structure, malignant or benign masses, bone loss, and cavities. Radiography can play important part in forensics odontology, mainly to establish identification. This may take the precise form of comparison between antemortem and postmortem radiograph. Radiograph may also be taken to determine the age of a minor victim and even help in the assessment of a sex and ethnic group. Comparable radiographs are an essential factor to confirm identification in a mass disaster. A radiographic image is formed by a controlled burst of X-ray radiation which penetrate oral structure at different levels depending on very anatomical densities before striking the film or sensor. Teeth appear lighter because less radiation penetrates them to reach the film. Dental impression. A clear impression means that there was a significant pressure. An obvious bite signifies medium pressure, and a noticeable impression means that a biter used violent pressure to bite down. Dental impression is a process by which odontologists attempt to match marks found at a crime scene with a dental impression of suspect. The movement of a person's jaws and tongue when they bite also contribute to the type of mark that is left. Latest research on teeth. Nanotechnology. Nanotechnology is emerging as an interdisciplinary field that is undergoing rapid development and has brought about enormous changes in medicine and dentistry. Nanotechnology has various applications in dentistry, including dentin renaturalization, therapy for dental hypersensitivity, complete orthodontic realignment in a single visit, covalently bonding diamondized enamel, enhancing property of root canal sealer, and continuous oral health maintenance using mechanical dentifrice robots. Benefits of nanotechnology in dentistry. Nanotechnology offers many benefits to the field of dentistry. It has enabled us to create more advanced material for dental implants such as compatible metals and ceramics. These materials are stronger and more resilient than traditional material, making them ideal for dental implants. Nanotechnology has also enabled us to develop new tools for diagnosing and treating dental disease. For example, nanosensor can be used to detect and diagnose disease at an early age, which can help prevent them from getting worse. Biomarkers. Tooth matrix biomarkers were used to identify windows of susceptibility to Mn, zinc, and Pb. Saliva diagnostics using various biomarkers seems to be the gateway to personalized dental diagnostic and therapy. At this time, however, the predominant discipline is periodontology, which allows biomarkers-based monitoring of the disease prevention and progressions. Teeth paleontology and evolutionary biology. Paleontology studies the teeth of modern animals to better understand the teeth of the animal found in the fossil record and determine how they are related to each other. Teeth are among the most distinctive and diagnostic features of mammal and fossil mammal species. Teeth are unique, enduring archive of a lifetime experience stretching back to before birth. The teeth of our human predecessor in the archaeological and fossil records are the prodigious stores of evidence. It is hardly surprising that many scientists dedicate their careers to unlocking the evidence from modern and fossil teeth. In Evolutions by paleontologist Peter Unger offers a compelling account of how the interaction of teeth, diet, and environment has shaped human evolution. Future prospects and challenges. Opportunity. Dentistry in early years of the 21st century is at critical juncture. As a result of advances in knowledge and understanding, science, material, and human behavior, people with access to effective and retaining more natural teeth for longer. If they are experiencing dental disease, there are ready remedies, including the possibility of long-lasting restoration, implant, retain, prosthesis when teeth fail. Challenges. It is not secret that dentists deal with a lot of mental and physical health issues. Maintaining health as a dentist is one of the hardest challenges. For example, the majority of dentists experience serious back, shoulder, and leg issues like chronic back pain, shoulder pain, and knee pain. Furthermore, a lot of dentists deal with mental health issues as well. The stress of maintaining financial stability, managing time, and client can take a toll on one's mental health. Dentists deal with a lot of emotional built-up, anxiety, depression, and even suicidal thoughts. Treatment planning. It is carefully sequenced series of service designed to eliminate or control etiological factor. It is a schedule and sequence of the treatment which have been outlined. It is created as a response to the problem list. It means developing a course of action that encompasses the ramification and sequel of treatment to serve patients' need. It is the blueprint for case management. Periodontists are specialized in the world of dentistry, working on prevention as well as diagnosis and treatment of gum disease alongside general dentists and dental hygienists. Improvements since those early times, dentistry has significantly evolved. Lucky for us, individuals now have access to toothbrushes, antiseptic, and fluoride mouthwash for daily oral care. Dentists now have anesthesia to help with pain during dental procedures. They use electric drills to clean out cavities and file teeth. Thank you.